for joining me here today. To date, in the state of South Dakota, we've had 626 positive cases of COVID-19 throughout South Dakota. 189 of those individuals have recovered. That's 30% of those cases that are better today. We have 431 active cases, and 238 of those, more than half, are employees of Smithfield. So that's why today I'm going to visit with you a little bit about Smithfield and a letter that the mayor of Sioux Falls, Paul Tenhagen, and I are sending to Smithfield, making some recommendations for them. I also have with me today Secretary of Health, Kim Malzum-Risden, who will be here to answer questions if you have any, and also Josh Clayton, who is our state epidemiologist. I want to thank them for consistently being here and being willing to take questions on the science and the facts and the data of how we're making decisions by an hour-by-hour basis. Today, I'm sending a joint letter with the mayor to Smithfield's president and CEO. We recommend in that letter that Smithfield operations suspend for a minimum of 14 days as soon as possible to protect the employees, the families, the Sioux Falls community, and the people of South Dakota. This isolation period is consistent with what we understand to be the incubation period of COVID-19, based on the science behind the virus, and it's based on the date of this letter as well. We're also asking that Smithfield continue to provide full pay and benefits for its employees during the 14-day suspension, as well as paid sick time for those that are infected and symptomatic, to encourage them to stay home in an effort to further prevent spreading of the virus to their families, to their community members, and the city of Sioux Falls. Now, I also want to take the opportunity to thank Sanford and Avera. They're going to be working together to set up a joint testing center for that hotspot for those individuals in Sioux Falls, and it'll be very valuable to us as we go through the coming weeks. More details will come on where that will be and how it will be facilitated, but I appreciate Sanford and Avera stepping up and making that happen for the people of South Dakota. I also want to take some time to go back and to level set on where we are in our state and how the projections that we have laid out impact us, and how we are following the guidance that we've looked at with other models across the country, what's happened in other countries as well across the world, and then what we're looking at as far as the science and the facts that we have today. I'm going to put back up some of the slides that we looked at about 8 days ago, last Friday, a week ago yesterday, that I showed you how South Dakota was making its decisions going forward, how we were planning for hospital capacity for our peak infection date, which, if remember, when we get to our peak date, we are planning to have 5,000 hospital beds in the state of South Dakota dedicated to COVID-19 patients. This slide, you remember, we started this slide with what we looked like with no mitigation measures that were in place at the beginning of March, and what our peak infection date would be, and going forward for how the spread was projected to happen to the state of South Dakota. Now, then I put in place an executive order, and if you remember that executive order, I said that state employees were going to work from home. We were closing schools, that we were going to make decisions to follow CDC guidance, keep groups under the size of 10 or less, and tell people to do that, make sure that businesses were changing their practices, being innovative, protecting their customers, but also their employees going forward. And then we also made sure that we were recommending to individuals what actions they could take for their families going forward as well. That executive order and that guidance was incredibly helpful, and the decisions that we made cut our peak infection rate in half. So people took this seriously, they followed it, they enacted it, and by doing that, we did push our peak date off longer, but we cut the need for hospital beds in half. And I'm incredibly impressed with how people in South Dakota have taken personal responsibility in this situation and made good decisions for our public health. Now, remember, I want to be very clear on this, because people still think that we can stop this virus. Everything we know using scientific data and facts on viruses tells us that we cannot stop this virus. We can't hope that in 2 weeks it's just going to be gone and everything will go back to normal. What we do know is we can slow it down. We can make sure that we are getting less people sick at one time, so that our hospitals and our health systems have the opportunity to take care of people and can focus on them and help them get better. And remember, 80% of the cases that will have this virus will have mild symptoms. That's good news for us. The reason that we're seeking to flatten this curve again is so that we can focus on individuals who need elevated health care, who need more attention, who might need a little bit of help to get through that tough situation. So going forward, thanks to your work, we have put ourselves in a place where we will be ready for that peak infection date. We have half of the hospitalizations that will be necessary that we're planning for. If you remember 8 days ago when I sat in front of you and explained to the state of South Dakota how we were making these decisions, I had representatives, doctors there with me that endorsed the plan for our state. They sat beside me and talked about how that plan was right for our state, how they were going to help us plan and add that capacity and make sure that we were taking care of our people. We are flattening the curve, and that is good news for us. Now I want to put up a slide that looks at our projections for the state of South Dakota, the real numbers that we have to remind ourselves of, because sometimes when we look at the number of positive cases and where they're happening in our state, it can kind of scare people. And I understand that. There's times where I felt like, boy, what's in front of us? How do I predict the future? And then I go back and I start looking at the science. I start talking to researchers that have spent their lifetimes looking at coronaviruses and studying them and how they spread and how we control them and what we can do as far as mitigating some of the damage that can happen. I look at the facts of what we have here in South Dakota and the resources that we have, and it brings perspective to the situation. The fact is that with the number of positive patients that we have in the state of South Dakota today, a little over 400 people, we're going to have days ahead where we're going to have many, many more people that are positive, that have this virus, that are infected. And there's going to be days where we have thousands of people that will be infected with this virus. In fact, if you look at this chart that I have up in front of me, you see that South Dakota's population is 882,235 people. Every single model out there has projected that 30% at the minimum of people we could plan on getting infected with the virus. That means here in South Dakota, 265,000 people will be infected with this virus at the best case scenario. Now, I'm not planning for the best case scenario. I'm planning for worst case scenario. I'm counting on you to do your part, but I also know my part is being a leader of the state and planning for worst case scenario so that I can take care of you, and using people who are educated, who know what they're doing to help give me informed information so that I can make decisions for you. That means that looking at this chart in front of us, and that when we have 265,000 to 600,000 people in our state, based on what we've been told by the experts we can expect for infections, on our peak infection date in June, which is what it is still projected to be, we will have 5,000 people that will need hospital beds that day because of the virus. That's what we're planning for. We're adding 5,000 more beds specifically for COVID-19 virus impacted individuals. We have somewhere around 33 people that have been hospitalized so far in the state of South Dakota. We don't have that many in the hospital today, but that's how many that we've had throughout the course that we've been through already. We know that we need to plan for 1,300 ventilators at our peak need, and we're planning for that as well. And remember, this plan, this chart I have in front of you, I put together with my Secretary of Health, the state epidemiologist, the experts in the Department of Health. All three of our healthcare systems did their own modeling and projections and came to this conclusion that this was the best plan going forward, and we were all going to work to make sure that it was successful. Now, I recognize that we're in a very fluid situation. We're dealing with a virus here that can be unpredictable. Our projections are dynamic. That means our projections are going to change. They could change by the day. They could change by the hour. They're not static. They're not going to stay the same. But the data is helping us prepare to handle our peak time, to prepare our healthcare systems to respond so that our people here will have the best care possible. What I need to do is to make sure that every action we take every single day is sustainable, that we can do this for weeks to come yet. Because we're not in the last 2 weeks of dealing with this virus. We're not even in the last month of dealing with this virus. I want everybody in the state to recognize that we will be talking about this virus and its continued spread and the infection growth for weeks to come. These numbers are going to continue to climb. And I also recognize that we got to make sure that we're taking care of families too, that we're keeping food on their tables, we're keeping a roof over their heads, that our kids are getting their education, that we're helping them mentally deal with the stresses that are coming because of the situation, and that we're coming alongside them and giving them hope. This response in our state doesn't need to be a one-size-fits-all. The vast majority of people that are in Minnehaha and Lincoln counties today are doing exactly what I've asked them to do. Every single time we are looking at an approach to use in a community, in a county, in the state, it is a targeted approach using information that we have there on the ground. We have to maintain a reasonable perspective so that we can make the best decisions for the people in the state. So now more than ever, I need you to adhere to the guidance that you put out. I need you to stay home. I need you to practice good hygiene. I need you to call your doctor if you're sick. And I need you to practice social distancing. We are nowhere near our peak infection rate. Emotions are running really high right now, and I understand that, but we need to remain calm. Just yesterday, Dr. Birx applauded us for our contact tracing that we're doing in the state by investigating how people have been in contact with other folks and how we can protect them and stop the spread and slow it down. Listen, I want you all to go right now to your phones and download the CARE-19 app that we unveiled just a day or two ago. That CARE-19 app is available in your app store. It's also, there's a link to it on the covid.sd.gov website. Go download that, participate, so that if you do happen to get in an unfortunate situation where you do test positive, we know everyone that you've been in contact with. It'll save us dozens and dozens of hours of time of investigations and interviews and trying to remember where you've been, and allow us to protect people quicker, which will help us prepare and take care of those who might end up getting sick as well. So with that, I'm going to pause and open it up to questions and see what specifics you may have for me, or our Secretary of Health, Kim Malzum-Risden, or for Dr. Josh Clayton, who is our state epidemiologist as well. Who has the first question? Yes.
Bob Mercer, KELOLAND News.
Yes, Bob, go ahead.
Do you expect the curve to come down as quickly as, or at the same pace that it's going up?
You know, it will all depend on how we go in and out of our mitigation measures. I can have Dr. Clayton speak to that as well, but mitigation measures they could take longer for us to work the virus through our state, the more we put in. But if we lift them all up and take them all off at one time, we could see another bump in our infection rates. And that's really what we need to make sure we're aware of. We could all go in our houses and not come out in 3 weeks. We could do that. We might slow down the spread now, but as soon as everybody came out of their house, we would spike with infection rates again, and then I'd be concerned that we'd have so many people sick at one time, we just wouldn't have the capacity to take care of them. So everything we need to do, we have to do, it needs to be measured, and needs to be an approach that makes sure that it's looked at through the viewpoint of what our healthcare systems can handle and how they're prepared to deal with those patients when they come their direction. Dr. Clayton, did you want to speak to that as well?
Sure, I can go ahead and add the perspective of, what we're focusing on really is trying to, as much as we possibly can, contain the virus through that contact tracing, which is focused on getting the individuals who are testing positive and having them isolate to home, and then identifying those close contacts, which is where the CARE-19 app does come into play, and it does help with that process of where individuals have gone and where they may have been exposed. That information we use to identify individuals and notify individuals who have been at close contacts of confirmed cases. The other piece of really our mitigation effort is looking at that community level. So what can we do to decrease the number of contacts that people have through social distancing, and making sure that you're minimizing or decreasing that risk, the likelihood of you encountering someone with the COVID-19 virus. So those are really the two pieces that, when used together, are very effective measures to combat this virus.
To the point of contact tracing, we've obviously been planning for the need to do this for some time now. We have effectively tripled the number of people that are deployed right now doing those investigations, doing that contact notification. We will be surging again next week, and we will be rolling out additional groups of staff that are in the state workforce already, as well as some other groups to help us with that. It's really, really important that we're able to keep up with that, and we're confident that our planning ahead for this will let us do that.
And I want to give you some information on why it's important to download that app. And please push it out to all your family and friends too. Because many times when someone tests positive, we start having conversations with them. Well, where were you in the last 3 days? What buildings did you go into? Did you talk to anybody there? A lot of times people can't remember all that. And it's not very accurate. If you download that app, you'll be able just to refer to the app then if you ever do test positive, and we'll have all the information there, and it'll save us time, but it'll also be much more accurate so that we know the individuals that we can go talk to and that we can make sure that they're taking protective measures as well going forward. And people ask me all the time, how do you know people are recovered? It's because when somebody tests positive, our Department of Health staff is talking to them every day. They're checking in on them, seeing how they're doing, having conversations, giving them advice, making sure that they're staying home, making sure that they're following the CDC guidance on what they can do. And then when they are fully recovered and cleared, that's when they add to the statistic of individuals. Today in South Dakota, we have 189 of them that are fully recovered, and we're grateful for that. So that's how we know people are following the directions and that they're staying there, is because every day we're having conversations with them. Patrick, did you have a question?
We discussed therapeutics the other day.
Yes.
That was one of the things that you wanted to see. So the question is, how's that going, and are therapeutics available to those that you're aware of right now, such as at the hotspot?
It's going good, and we have an announcement on that on Monday. I would ask everybody to tune in to our press conference on Monday.
Governor, can we
Yes.
get a copy of the letter?
Of the letter we sent to Smithfield? Absolutely, yes. Bob's question was if we could give him a copy of the letter we sent to Smithfield, and we will certainly do that. Question on the phone?
Yes, Beth Warden with Dakota News Now in Sioux Falls. We've heard from employees of several different businesses that had concerns over lack of social distancing or lack of sanitization in the workplace, yet they were concerned to report it for fear of their job. Who can they talk to report these concerns?
You know, I would encourage them to call the Department of Health. They would call our secretary's contact line on covid.sd.gov. There's contact information there. We will not compromise their information. We just want to know where we can help people make better decisions to keep the public safe.
Governor, this is Jackie with SDPD.
Yes, Jackie, go ahead.
I know you've been in contact with the CEO of Smithfield over the last week or so. I'm wondering if in any of those conversations this possibility of closing for a longer period of time was part of those talks.
We had several discussions about different mitigation measures that they could take. And so this, we believe, is appropriate action, the mayor and I today, to recommend to them, and we'll look forward to their response. Further questions on the phone?
Governor Nick Reagan, Dakota Territory News.
Yes, Nick, go ahead.
So will the employees over at Smithfield be able to get tested whether or not they technically qualify for the test?
I'm going to let the Secretary of Health speak to that, because obviously testing capacity is important, and using those resources wisely is important. So I'm going to let her address specifically your question and how we're taking our approach.
Thank you, Governor. So our future actions with the folks that work at Smithfield are to ensure that they all have good information, information that they can understand about this virus and about symptoms. We will be looking at making sure that people understand that so they can monitor their own health, they can monitor the health of other people that they might be living with. We are grateful, as the governor indicated, that Avera and Sanford are going to be working on additional testing capacity to ensure that folks that do have symptoms have the ability to get a test. We will be doing that communication with folks so that they know how to access that testing, when they should consider that. And then if they do become positive or their test comes back positive, we'll be continuing to do the investigation work that we do to make sure that people stay safe. And so we will be working in partnership with several groups within the Sioux Falls community that can help us with that. That includes groups like LSS, the Multicultural Center, the faith community, the Sioux Falls Public Health Department. And it's really going to take all of us working together to make sure we're reaching this population effectively and for the course of time that they're going to be dealing with this. We're optimistic, though, that we will have testing available as needed, and that will be for people that have symptoms of COVID-19.
So it sounds like the answer to that then is that those employees will still have to qualify for the test in order to get it.
People will have to show that they have symptoms. We can't test employees and have an accurate diagnosis. We could test them in the morning. That test could come back negative. By afternoon, they could be positive. We don't necessarily know when they've been exposed, when they would be contagious, when they wouldn't be contagious. The only thing we can measure is when they actually have symptoms. And obviously, we have to make sure that we have resources available to take care of all the people in the state of South Dakota, and that testing capacity needs to be there when we need it. Josh, do you want to speak to that too?
So I think it's important to recognize that the reason that we are doing testing of individuals that have symptoms is because as the governor mentioned, an individual may have already been exposed, and there are detection limits of how the test is able to identify the virus in that person's specimen. And so when you're testing somebody who doesn't have symptoms, you're decreasing the likelihood of identifying those individuals, and you're in essence kind of wasting a test. I think it's important that we are focused on identifying those who have symptoms to maximize how we're able to conduct testing, make sure we're able to conduct testing not only today but in the future, because it's really important that we have that capability of testing individuals who are symptomatic, and so just making sure that we are good stewards of the testing availability that we have.
And I'm gonna ask. I'm going to hold on a question quick because I want the Secretary of Health to speak specifically to the testing that we're doing as it relates to Smithfield employees, because we are testing that population at a higher rate right now.
Thank you, Governor. So as we have been working with the Smithfield as an employer and seeing, the start of some cases last week in that particular setting, the health provider for that employer offered to do enhanced testing of that particular population, which is in part why we're seeing identification of more cases. So the more that you test, the more cases you're going to find. And so that's proper protocol in a situation where you suspect there might be transmission of a large number of people. And so very pleased with how that has rolled out and how that has helped us again identify positive people within that particular employer group, get to those people that they may have been in close contact with so that we can reduce potential other exposures. But we have been testing at an enhanced rate for the employees of Smithfield, and anybody that has had symptoms up to this point, I'm confident has been able to get a test.
Governor, what is Smithfield system? What have they turned to?
We'll make a decision at that time. Their mitigation measures and our conversations have gone well so far. This is a recommendation that we are making to Smithfield today, and we'll keep you posted on their response.
Beth Warden again from Dakota News Now in Sioux Falls. What if Smithfield does not comply with your request? What recourse do you have?
Yeah, that was the question that Bob just asked, and my response back to Bob was that our conversations previously had gone well with their mitigation measures, and also their response to us. We'll see how they respond to the letter before we speculate on what needs to happen.
Is there a deadline?
No, there's no deadline. But I do anticipate that they'll be giving us a response shortly.
Just to follow up, do you see this as an extension of the current 3-day shutdown?
Governor Kent Bush,
Yes,
Rapid
it would.
City Journal.
Rapid City Journal, did you have a question?
Yes. Would the state be giving aid to Smithfield for being willing to shut down for 2 weeks? Will you help with that since you're asking them to pay their employees and maintain benefits, or is that something you're asking them to do?
Are you asking if we're going to give them financial aid to do this?
Correct.
No, we will not be giving them financial aid to do this. And as you're well aware, revenues for the state have completely dried up since this virus has hit our state. So we are being very diligent with how we're spending taxpayer money in light of the fact that we will have very little in the days to come.
Governor, question for you. In
Sure.
reference to the app that is being released, what are you doing to ensure the privacy of the tracking information that would be on there?
Yeah, that was all built into the app with security measures that are enforceable. It is a voluntary app. We are asking people to participate, and all the information will be destroyed when we get through this virus.
Governor, this is Chelsea Dickens at News Center 1.
Yes, Chelsea, go ahead.
So, in terms of other meat processing plants throughout the state, as we have wall meat here in the west side of the state, should there be other concerns from them? Maybe more measures that to take to just be precautious to avoid this happening again? Many of them are also donating food out here as well to other people. So I'm curious to know your comments to that.
We have been working with all businesses in the state to make sure that they're taking measures that are recommended by the CDC to protect their employees from this virus and also to protect the public health. I will let Dr. Clayton talk specifically about how this virus relates to food products.
So specifically, when we're looking at with the COVID-19 virus, there really is, no risk for the actual food that is being produced by in any of these facilities. I think it's important to remember that we have been working with businesses, both those that are producing food and are part of that critical infrastructure, as well as other businesses, to make sure that they have received the CDC guidance on what they can be doing to really reduce any potential spread of COVID-19 within their facilities.
Further questions?
Governor, this is Paul from the Groton Daily Independent.
Yes, Paul.
What kind of Easter message would you like to give us here in South Dakota?
Tomorrow is Resurrection Sunday. It's a day of hope, and I would say that is a celebration day, typically every year for Christians around the world, and that we should focus on that and what it means to each and every one of us and our families at this special time.
And I know many South Dakotans would like to thank you for all the work and effort that you and your staff are doing and with this virus that's going on.
Thank you, Paul. I really appreciate that more than you know. Further questions? Well, thank you, everybody. Happy Easter.